This is one of the most important days in healthcare in American history. The President tonight is going to make a very important speech to the joint session of Congress, maybe the most important speech since his inaugural address back in January. He's decided to talk with the entire nation. I hope that he's going to take a practical, common sense, bipartisan approach. And that would be a big change from where the health debate has been for the last 2 months. For 2 months, there have been a lot of effort to pass a giant, comprehensive 1,300-page bill, a bill that would probably require 50,000 pages of regulations and would create 45 or 50 new agencies, organizations, and bureaucracies. I think that's a bill that's doomed to fail. I hope tonight that the President's going to take a different approach, an approach that I recommended to Mrs. Clinton back in 1993. She came to see us, and I said, you know, health is too big and too complicated to try to solve it with one bill. Nobody's smart enough to deal with 18% of the economy, almost every fifth dollar of the largest economy in the world. No one's smart enough to deal with every aspect of saving lives and dealing with people. And if you could write the perfect, gigantic bill, you would arouse so many different forces against you that the bill would fail. Unfortunately, she didn't follow that advice. She wrote a huge bill, aroused huge opponents, and the bill failed. Now we're back at almost exactly the point we were just before Hillary Care failed. The President has a real opportunity. If he'll take a deep breath and step back, not try to sell the country on one bill with one solution with 1,300 pages, but instead offer to work on good ideas, good approaches with the whole country, and to do it in a series of smaller bills. There are 5 or 6 big ideas, each of which could be handled in a bill of 150 pages, that could get through on their own. Open amendments, open debate, everybody understanding what's in them. Fundamentally different than writing a massive 1,300-page bill that nobody understands. At the Center for Health Transformation, we've spent years working on a bipartisan basis with governors, with doctors, with hospitals, with medical experts, with members of Congress from both parties. We believe there are at least 5 major bills that could be written, each standing on its own, that would be very powerful. Let me share them with you. At the Center for Health Transformation, first, we believe that there ought to be a litigation reform bill to block frivolous lawsuits, to make it unnecessary to have defensive medicine. We think you could save billions of dollars a year if doctors could practice good medicine and not have to take extra tests and extra procedures and do extra things just in case there's a lawsuit someday. So the first step we ought to take is litigation reform, which will increase the number of people willing to be doctors, make it easier for doctors to focus on good medicine, and save a lot of money in its own right. The second step we believe we ought to take is to use real effort at finding best practices, including prevention, wellness, early treatment, helping people manage their chronic conditions. We believe if you have a migration to a health-based health reform, where you try to find the hospitals and the doctors that do the best job, and then get other people to migrate to learn how to do that best job, we think you could take between 20 and 40% out of the cost of the current health system. That's an enormous amount of money, maybe as much as $400 to $800 billion a year once the system was operating at its full effectiveness. Not by having federal bureaucrats, not by red tape, not by rationing, but by getting people to do the right thing the right way the first time. And that, we believe, is a freestanding bill that would be very powerful and very effective. Third, we believe if you really want to save money in Medicare and Medicaid, then stop paying the crooks. In fact, at the Center for Health Transformation, that's the title of a book that Jim Froeg edited with 13 experts. And in Stop Paying the Crooks, they outline that the federal government does such a bad job of administering Medicare and Medicaid that somewhere between $70 and $120 billion a year is stolen from the taxpayer and stolen from those who need the medicine. One example is in Miami, where 5 pizza parlors were certified by the state Medicaid program as HIV/AIDS transfusion centers. In New York, a dentist filed 982 procedures a day and got paid. Again and again, you find that because the government is such an inefficient and ineffective manager, that people are just stealing us, stealing billions. And so we believe passing a bill that would clean up the system could save literally somewhere between $50 and $100 billion a year, far more than the president's trying to save, without taking a single penny away from senior citizens or a single penny away from honest doctors and honest hospitals. Fourth, we do believe there should be reforms of the insurance system. We believe there ought to be a lot more competition across state boundaries. We believe there can be requirements made so no one will lose their insurance because of a precondition. And we believe with the right competition and the right structure that the price of insurance will come down. And if you combine with that tax reform so that everybody gets exactly the same tax break, whether you buy your own insurance or you work through an employer, but everybody has the same tax break, we believe you can make it possible for millions of additional people to buy health insurance and to do so within a private system where they are in control of their lives. Finally, at the Center for Health Transformation, we have launched an Alzheimer's solution project that is a model of how in the future we can have much better outcomes at much lower cost so people can live longer, live healthier, and live more independently. The fact is that the science is growing very rapidly that could enable us to find breakthroughs in Alzheimer's, and if we could by 2020 or 2025 block Alzheimer's as a disease, we could save over $10 trillion between now and 2050. There aren't many places where you can make that kind of an investment and get that kind of an outcome. And so we believe there ought to be a fundamentally new approach to science, to basic research and investment, to try to find ways to have better health, which then means it's less expensive. These are 5 practical, doable ideas. We believe all 5 have tremendous support from the American people. We believe all 5 could be done in a bipartisan way out in the open. And we hope that the president will back off from a huge, complex, hard to understand 1,300-page bill that nobody really understands. And we hope he'll back off from trying to drive through a narrow, partisan left-wing bill. And instead, we hope he'll work with all Americans to pass practical, common-sense legislation in an orderly manner by taking it up one step at a time and getting the job done over the next 5 or 6 months. That's what I'm going to be looking for as I watch the president tonight.